everybody. Welcome back. I've got Dr. Erin Amato with me now, who has some information about ketamine, something you may have been hearing about. Thank you so much for joining us today.
Yes, thanks for having me.
Of course, of course. So we are excited to learn exactly what this is.
Yes, well, it's an exciting development. And actually, ketamine is not a new development. It's been around for years and has been used as a surgical anesthetic. But more recent research has shown that it has powerful antidepressant effects. So, for people who have been suffering from depression and haven't found relief from traditional antidepressants, this is a really exciting breakthrough.
Wow, that sounds like it. So do people, need a prescription for this, or how is this being used?
Yeah, so it's something that can be administered in different forms. It can be given as an IV infusion, as an injection, and there's even an FDA approved form that's called S-ketamine or Spravato that's given as a nasal spray in the doctor's office using a special cartridge like this one.
Oh, wow. That is so interesting. So, you being in the medical field, what does this mean for you and for your patients to have this option?
Well, it's a tremendous breakthrough because we know that so many people suffer from depression. And even this time of year is really difficult heading into the holidays. We know that about 65% of people with a mental illness say that this time of year actually makes their condition worse. And right now, we're seeing such an uptick in depression and anxiety since the pandemic. The pandemic has just made a mess of our mental health. So, to have another tool in the toolbox when medications aren't working is so critical because we know that a third of people who do try antidepressant medicines for the depression fall into the category of having what's called treatment resistant depression, meaning that they really don't respond to the medicines. So we need better, more effective treatments.
Wow, wow. That is a lot. Yeah, like you said, a lot of information, a lot of breakthroughs there. So when for everybody out there who's saying, okay, well, what exactly is it? I'm skeptical, how do you describe it to them?
Yeah, so like I said, it's a treatment that's been around. It's a medication that's been around since the early 60s, used for a long time as a surgical anesthetic. But it's something that people should really consider if they haven't responded to medications because it works really rapidly. That's another amazing feature of it is that it works within hours to days instead of the weeks to months that it can sometimes take with antidepressant medicines. And that's really critical when someone is severely depressed or having suicidal thoughts or they're dealing with trauma that they're not able to move past. Having something that works quickly is really critical.
So for everyone who, they're like, okay, I'm exactly what she just described, I'm one of those scenarios. How do they go about, I guess, taking that next step to, talk to their doctor?
Yeah, so for anyone who is suffering from depression, not responding to medications, if you're working with a psychiatrist or a primary care doctor, talk to them about this treatment. And then if they don't do the treatment themselves, they can refer you to someone in the community. And a great resource is the website for the American Society of Ketamine Physicians. That's askp.org. And they have a locator map on their website where you can look at your area and find someone close to you who administers this treatment.
Wow. Well, doctor, thank you so much for joining us and sharing all this wonderful information. Do you have any final thoughts you want to share?
It's a treatment that's helping so many people. And right now, you may be hearing things in the news about psychedelic medicines and how exciting it is in the world of psychiatry. And ketamine does produce some psychedelic effects that are an important part of the healing process, but it's being used to help everyone from school teachers to first responders to grandmas to teenagers. So it really can be something that can be helpful if you're suffering and not finding relief.
Well, thank you again so much for coming on and sharing this information.